of tremendous public-private collaboration, actually, in many countries. I think really what has not worked very well, in my opinion, is global collaboration, and also, better preparedness. So if we think about healthcare systems in the future and how do we invest and shape what we do to be better prepared, the first thing to do is to invest in prevention and early detection and early treatment. If you think about how the money today is deployed, in the OECD countries, for instance, about 3% of total health expenditure is spent on prevention, only 3%. We always say it's better to prevent than cure or treat, and everybody will agree, but the reality of the numbers is that only 3% of healthcare expenditures is spent on prevention. 20% of this 3%, which is 0.6% of total healthcare expenditures, is spent on immunization and early detection of disease. So essentially, we kind of tend to wait for people to become sick to kind of try to address that, as opposed to early detecting disease and preventing it. On the other hand, for instance, an example of an example of a disease where we spend a lot of money is chronic kidney disease, and about 80% of chronic kidney disease patients are not diagnosed. So a lot of people have chronic kidney disease. They are not diagnosed, and they get worse and worse and worse over time until they end up quite sick, potentially in dialysis, and of course becoming very expensive for healthcare budgets, on top of the miserable life that they end up living, being on dialysis. So again, investing in diagnosing those patients early, treating them early would be a much better investment of healthcare dollars. So whether it's viral infections or whether it's just other diseases, a lot more investment in preventions need to go. We also need to optimize, I think, the place where healthcare is delivered. There's a lot of reliance on hospitals, and we need to try and shift care to the outpatient services, to GPs in particular, and a number of countries are doing this, but need to increase that and rely more on digital tools to facilitate the treatment of patients outside hospitals. Digital innovation is really helping a lot. In our case, in our company, we have really leveraged digital tools a lot over the last 12 months, 10 to 12 months, to help patients continue to be treated outside the hospital because they didn't want to go to the hospital and therefore were not treated properly. People who have chronic asthma, people who have other chronic conditions, cancer. The use of digital innovation has been a tremendous tool to help keep these patients being treated without having to necessarily go to the hospital as much as before. And we all know, because we've experienced it, doctors are now using a lot more digital tools to interact with their patients, and it's improving productivity, but also improving the way care is delivered at scale, quite frankly. The last thing I would say is that we also need a shift in mindset, and we need to consider health as a strategic asset that you invest in as opposed to a cost that you try to minimize. And a lot of efforts today go into minimizing the cost of healthcare, when in fact we realize when people are sick, the economy can be pretty much damaged. And of course, COVID is a great example of this. So it's important for governments and people around the world to shift the mindset to health is an asset that you invest in as opposed to a cost you minimize. And of course, you try to improve equity, because typically, especially in case of infections, we're only safe when everybody is safe. And that's why at AstraZeneca, we decided to provide this vaccine to everybody around the world at no profit and as quickly as possible, so that we could stop the virus from spreading and potentially mutating and returning to the rich countries.
Thank you, Pascal. So early detection and prevention and diagnostics, which is really up the street of Katerina, because that's what she focuses on. So let me draw her in at this point on the same question that I had for you. What are some of the 2 or 3 big ideas you think we need to take away from our experience? Katerina.
Yeah, sure, thank you. And let me just say, But I'm speaking here on behalf of FIND, but also on behalf of the ACT Accelerator, the global response to COVID, where we co-lead with the Global Fund the diagnostic pillar. So as has been said, the world has been paying a price for the chronic underinvestment in test and diagnostic infrastructure. Testing, as Pascal has said, is the backbone for resilient healthcare systems. It's really our eyes and ears, and for every outbreak, it will be our first line of defense to halt it. Industry and the ACT Accelerator during this crisis have moved fast in terms of high-speed development and scale-up of tests, that have allowed implementing now of mass testing in care homes, in schools, in workplaces. But while we have been moving fast, so has the virus, right? As you know, every day we're seeing new strains emerge more easily, more transmissible, and potentially more deadly. And for 70% of the world, we barely know what's going on. We have very little testing rates in low and middle income countries. We test an average 10 times less than in high income countries. We have very little or no sequencing capacity in most countries. And so we fly blind in a lot of places. This situation has to change, not just to exit this crisis, but to prevent future crises. We owe it to all those that died from COVID-19 to make sure that we build on the investments during this crisis. We will have tripled our manufacturing capacity for diagnostics. We will have advanced digital technologies and will be at the forefront in terms of CRISPR and other cutting-edge technologies. And so let's make sure together that this investment in testing is sustained and can be used for the next crisis and to avoid the next crisis.
Thanks, Katharina. Just a very quick follow-up for you. I just come from a conference that was held here in Singapore, where every delegate had to go through a very quick test, an antigen test, and the results came back within 20 minutes or so. So that technology has been improving over the last year or so. How far have we progressed in terms of managing the technology as well as getting the cost down so that we can get it out to more and more people?
Absolutely. So we've made a lot of progress, both in terms of the high performance of these tests. They're very accurate now, but especially also when it comes to the cost. We've just announced with several industry partners on Friday an agreement that enables testing at $2.50 per test for low and middle income countries. And that is compared to starting price in August of over $20. So it's a big shift.
Okay, thank you, Katharina. Then let me move to Kevin from the US. Kevin, let's hear your opening thoughts, especially because a pandemic like this also involves getting the community involved, and they have to be part of the solution, certainly.
Absolutely. Thank you again for me being here. Appreciate the opportunity to speak on behalf of what you were saying. And from a non-clinician perspective, first of all, I think it's important that there's a stronger connection from clinic to community, because we all know that at least 80% of health outcomes happen outside of the clinical system. Secondarily, particularly in the United States, we absolutely have to move toward universal health care. That is a particular issue that has to happen. And the other thing that's important in the States is we, as you know, we have a systemic racism issue that is prevalent in our country. And that has been breaking down that trust to ensure people of low income or different backgrounds get the opportunity to engage in the healthcare system. Without that, we will never be able to tackle pandemics. Even now, as we're going through the vaccine process, there are several people of color who distrust the system and will not accept the vaccine because of the historical nature of what they had to deal with. So stronger clinical to community connections, making sure we move toward a universal healthcare system, because in the States, your healthcare in most instances is directed to your occupation So in this pandemic, and you lose your occupation, many folks are losing their healthcare. So universal healthcare, and more importantly, stronger clinic connection issues, and continuing to address the racial inequities and the systemic racism that have prevented so many people from seeking the healthcare system in our country.
Thank you, Kevin. You touched on the issue of trust, and I think that's so critical because, if people don't have trust in the system and the science, then it's hard to communicate basic information about the importance of hygiene and wearing masks and things like that. But trust is something you need to build up outside of the crisis. It's like a bank account. You got to build it up so you can draw it down when the crisis hits. And we're interested to hear your thoughts on that issue of what we can do to build up the trust ahead of the next crisis.
I think the most important thing is working with those agencies and organizations, and I'll say, like the Y, who are in these communities that have built up levels of trust. There's so many churches, nonprofit entities that the clinicians can work through and with to help build that trust. People trust those organizations because they've been around them for quite a while. So the opportunity to work collaboratively with them. I can give you a specific example. I know in Philadelphia, where I live quite a bit of my time at, the Black Doctors Association having been on the ground doing quite a bit of work. And that is because people know them, they've had the opportunity to connect with them. That's built up quite a bit of trust. So they're being able to expedite the vaccine program because of the level of trust. And they're going to barbershops, they're going to churches, they're going to community entities where people have access to get to those entities. And that has helped build up some of the trust. That shouldn't stop at this pandemic. It should be something that continues all the time. That's how you continue to build up the trust.
Thank you. Let me draw in Mazen at this point. Mazen, your initial thoughts about what we can do better for the next pandemic, especially to help communities that are less well off and more in need of help to deal with these crises.
Thank you, Warren. Actually, in the Middle East, what we witnessed was basically the vulnerable communities were the hardest hit, number one. Number two, we saw a lot of slow response from the decision-making institutions in the public sector, the governments. So what we did, and I think a very good lesson learned, was to support the vulnerable communities by giving them access to medicine. The doctors in many countries where they don't have communication. Also, we did what Pascal has said. This has been a very good tool for the telehealth communication with doctors, especially in countries where we're vulnerable, like Sudan, like Algeria, like Syria, Lebanon. All of these countries were very vulnerable, the communities in them in Iraq. So we reached out by trying to provide the latest of what's going on. We work with the governments in providing them with the necessary protocols, especially for the outbreak, because the Arab countries, the 18 different Arab countries, every country had different response from other countries. So we work very closely with the healthcare communities in providing them with what's the latest in terms of technology. One of the other issues is very important is basically the supply linkages to enhance global trade. We witnessed the shortages in many countries, what they started doing by introducing global trade by having national hoarding for APIs and supply of raw materials. And this really hurt a lot the supply chain going forward, especially at the beginning. Then we were able to overcome this by getting in contact with the governments directly and by some backdoor negotiations, I would say, with these governments in order to show them the seriousness of what has been done. At the same time, responding quickly to the supply chain demand of hospitals, because, for example, when there were shortages in the US for the generic pharmaceuticals, we were able to shift our production lines to produce more injectables in order to provide the healthcare providers with medication, especially in the injectable line for treating COVID patients. So all of this, because we are a generic company and we expand our reaches in a very different market segment than the European and the other markets. So we were able to focus on these things and basically build trust. But going forward, I think there must be more cooperation between the different healthcare communities, and especially in this part of the world, the Arab world I'm talking about, and supporting the vulnerable communities where we have witnessed a huge I would say, healthcare infrastructure with these communities. So we went in and we worked a lot with the governments and with the local communities, with the NGOs, in order to build also a trust with them in order to accept what's going on and see how we can get through this pandemic going forward.
Mazen, the World Health Organization has spoken about a catastrophic moral failure in terms of the delivery of vaccines to less well-off communities. I mean, 40 billion jabs in nearly 50 rich countries, but only 25 in poor countries. Do you think that's something we're going to have to do much better on in terms of, making sure everybody is safe, because nobody is safe until all of us are safe?
Yeah, and I think what Pascal has said, I commend what AstraZeneca and the other multinationals have done in providing with the different programs, vaccinations for the vulnerable communities. Because really what you see, the vulnerability of these communities, they will have a very long list of the supply chain when it comes to them. And we're witnessing that in many countries. And I think the world has to live up to the standards of providing better healthcare for everyone. So the report about the WHO, I believe, has been actual, but also the WHO, what we noticed at the beginning, they were giving very contradicting statements. So also this is something I think we have to build trust again in these international institutions. I hope now with the things that are going on in the world politics, it will allow people to have more trust in these multinational organizations to provide better healthcare solutions for the communities going forward.
Thank you. I'd like to bring the discussion back to the issue of collaboration, between countries and collaboration between the nations at national level and the state level, as well as collaboration between the public and private sector, because I think it's absolutely critical if we can sort of get people working together. And maybe I could start by asking Katerina to address that question. Better collaboration at different levels, maybe industry, state, government.
Absolutely. I think a couple of successful examples have already been highlighted, but let me maybe speak a little bit more concretely about the vital role of industry in the COVID-19 crisis response now, but then also in helping us build sustainable, resilient health systems. So, industry has a vital role to play for me in two regards. And that goes far beyond healthcare industry. A, lead and advocate. So what we need from a testing perspective today is that industry takes a leadership position, builds good workplace testing strategies, and advocates with governments to help us get the funding necessary to drive an equitable testing response in all countries. That is absolutely key to restart the global economy and avoid a much deeper crisis going forward. With the focus on vaccines, we see that many countries even sort of decrease their testing, and that we're at a very dangerous point here. And then second, we need industry to continue to commit and invest. Invest in R&D, of course, and also the scale up of testing. To help us, for example, build a strong sequencing network that relies also on digital solutions, on supply chain solutions. But we need a globally connected sequencing network. Second, the commitment part. We have been successful in getting the costs down, but we have to get the price down further, especially if we want to enable mass testing now for COVID, but then why testing for differential diagnoses going forward, right? For example, identifying any kind of respiratory virus and outbreak early. So for that, we need industry, for example, to join our buyers consortium very concretely, to set up best-in-class testing strategies at their workplaces for their own workforce, but then also contribute to the global effort, and by having a pooled buyers consortium to allow us to get the price down and to enable greater forecasting abilities, etc., in terms of supply chain, manufacturing, and so forth. Thank you.
Thanks, Katerina. I'd like to turn back to Pascal. On the issue of collaboration. AstraZeneca has been working with the WEF as well as LSE on an initiative to help bring parties together to help promote collaboration and mutual sharing of information. Maybe you could tell us a little bit about that initiative so that folks who are watching this might be informed about that.
Collaboration, I think, is absolutely critical, and it is in the DNA of our company. You cannot be in innovation if you're not prepared to collaborate, because it's out of collaboration that innovation emerges. So we do this constantly with academia and various other parties. I think the COVID is a good example of a situation where we had many good examples of public-private partnerships. Our partnership with Oxford University, being an academic center, and also governments around the world, is a good one, with BARDA, Pfizer, Moderna, J&J. Everybody has collaborated with various private and public actors to really deliver the vaccine as quickly as possible. And we should remember that what we're trying to do collectively here has never been done in the history of the world, to develop a vaccine or several vaccines in that instance in a year, and then scale up to billions of doses, when we know today the biggest manufacturer has only got a capacity of 1 billion doses per year across all their vaccines. So it's a huge undertaking that has only been possible because we've collaborated. In our case, an important collaboration is with Serum Institute of India, which is really enabling us to supply the vaccine to the low middle income countries at a very, very low cost. So in fact, we do it at no profit. So we make sure that everybody around the world is protected. And so, we also believe that we can apply this collaboration to the future to bring, again, public and private actors to work on how can we make healthcare system more resilient, more sustainable in the future. And we have a partnership with the WEF and the London School of Economics that has started, that is called the Partnership for Health System Sustainability and Resilience. And the idea really is to work on what policies should be put in place so we bring a better collaboration. I have to say the first phase of COVID is full of good examples, but it's also full of places where we see international collaboration hasn't been the best. Could have been a 4th of July Independence Day kind of a moment, but it unfortunately wasn't, because there was a little bit of me first behavior. But I can see that things are changing, and international collaboration is emerging around areas of identifying early signs of new infections, new pandemics, looking at mutations. This virus is going to mutate. We need to track it, and we need to look at the emerging strains. So there is more and more, I think, collaboration that is actually emerging out of this crisis.
Thanks, Pascal. I was watching your collaboration with my alma mater and cheering you on all the way. So I was glad to see that collaboration between industry and universities working so well and delivering the vaccine so quickly. We do need to wrap up the public session of this discussion before we move into the closed private discussion on ways in which we can collaborate more closely. If you want more information on the collaboration between AstraZeneca, WEF, and LSE, you can look at it on the website. I need to wrap up this session to say basically that some of the big ideas that have been put forward about early detection and prevention, better diagnostics, linking up outpatient care and moving it more to the community, building up testing as well as trust in the system and in the science are all things we need to do if we're going to build crisis-resistant and crisis-resilient systems for future crises. So I'll have to wrap it up there. We will take questions in the next segment of the discussion, and I'll try to get to as many questions in the limited time that we have. So thank you. If you are dialing into the top link, please stay on if you are a WEF member, and we'll continue the discussion shortly.